Okay, for the blood supply of the soft tissues, no? Here at the superficial face. So, in one of our dissection videos, I think we have already identified the facial artery, one branch of the external carotid artery. No? You can see it right here. The segment that after penetrating the area where we have the submandibular salivary gland, no? The artery courses up and it will reach this area here, lateral to the nose, no? But it will continue to send the branches, no? That will form part of the blood supply to the scalp, no? Which covers this part of the forehead. So the facial artery will also have branches going to the upper lip, no? That's the superior labial artery, no? As well as to the lower lip, inferior labial artery. You can also see right here, alongside but not really running close to the artery. This is the facial vein. So try to review where does it drain. The facial vein, where does it drain? It's one of the tributaries of what the large vein of the neck. And right here, near in front of the ear. So there's an artery right there, and you can see, no, another darker colored vessel, no, adjacent to our artery. No? The artery is the superficial temporal artery. Superficial temporal artery, and the venae commitantes, no, takes the same name. No? That's your superficial temporal vein. So the artery supplies, no, the side of the head or the temples. No? It will also reach the scalp that covers the head, temporal region, no? Actually up to the parietal region. And its smaller branches will have anastomosis with the branches of the facial artery. And it will also send the branches, no, going here to the maxillary area, no, of the face. No? Superficial temporal artery is part of the blood supply to the face. No? Particularly here, maxillary area or maxillary region of the face. No? So this dark colored fleshy mass that we can see right here, that's already the parotid gland, no? One of the major salivary glands of our face, no? Our head. So this one, this is not a vessel, no? This is the parotid duct or Stensen's duct, duct of Stensen. So that's the eponym of for our parotid duct. The duct, no, it's a large duct, and it will pierce, no, the buccinator muscle found here in the cheek, no, and it will open and drain at the buccal mucosa of the cheek, no, roughly at the level of the second maxillary molar tooth, no, of the upper jaw. So large amount of the buccal fat pad has been removed, no, from this area, so that the vessels and the ducts are uncovered, no, and clearly exposed. No? So the muscle that is part of the cheeks, no, adherent to the buccal mucosa, that's the buccinator muscle or trumpeter's muscle, one of the muscles that allows us to puff our cheeks, no? We puff our cheeks when we blow, no? Air from our mouth, no? When we play wind instruments, no? Like the trumpet, the saxophone. So it's also innervated by the facial nerve. Let me show you the same area, no, on the other side, no. This one is not yet completely dissected, no. As you can see, you have a thick buccal fat pad right there, no. So we have to remove, no, the fatty tissue and connective tissue before we can expose structures like the facial artery there, the facial vein, and Stenson's duct. So the parotid duct is one of the major salivary glands of the body. Its secretion is predominantly serous, no? Meaning enzyme rich, no? Watery in consistency and enzyme rich, no? And a little part of its secretion, no, contains mucin or mucoid protein, no? So this one again, that's the submandibular gland, no? We cannot see its duct, no, because its duct will pierce and go it will penetrate the floor of mouth area. So this is a mixed salivary gland, no? Almost 50-50 of its secretion, no? 50% is serous and 50% is mucinous. There is another major salivary gland that is not visible at this time. That is the sublingual salivary gland, no? Its secretion is mainly mucinous, no? The mucinous secretion is mainly for food lubrication, or it lubricates just about anything, no, that you place inside your mouth, no? I'm sure you place other stuff in your mouth, no, other than food, no? The kitchen utensils, no, spoon and fork, for example, we place that in our mouth, no? Sometimes we use oral thermometer also for temperature taking. For the other stuff that you place in your mouth, no, I will just leave that up for you, or for your imagination, no?